In addition to the readings on chapters 17 and 18 from the text, and the supplemental information provided in this week's module, there are a few additional points to consider when exploring prevention and treatment services. The first area involves important provider considerations. When working in the addiction and recovery field, all providers need to be aware of the distinction between personal and professional values. This is extremely important to grasp as it relates to maintaining effective and ethical services for our clients, as well as ensuring a respectful work environment with our colleagues. One way to ensure this is to understand the distinction between personal and professional beliefs and values. Each of us will have a range of personal beliefs and opinions which we're all entitled to. The idea of working in the field is not that we have to change or give up our own beliefs. What is required is that when working in a professional capacity, we all need to demonstrate a commitment to professional values and ethics in the workplace. This means that we do not force our own beliefs onto clients or colleagues. In addition, it means that we are committed to offering client services based on their own needs and requests, working to eliminate barriers to services, and fostering collegial and respectful relationships with our coworkers. When thinking about the treatment field, it is very common that personal experience often influences one's interest in getting into the field and becoming a clinician. When people, having gone through their own recovery, develop an interest in becoming a professional provider, there can be many benefits to having recovery providers in the field. Examples of these benefits include firsthand experience with recovery. They really have an insider's view on what recovery entails. In addition, they can also be very knowledgeable about treatment services, where to access services, issues of waiting lists, etc. These are just a few ways a first-hand experience of recovery can be very beneficial in the field. However, it is also important to recognize that some potential concerns can arise if the boundary between personal and professional values is not maintained. Some examples of this area is that, quote-unquote, my way is best, meaning this worked for me in my recovery, so it's bound to be the best way for everyone. The reality is that recovery is an individualized process and there is no one approach that works for everyone. There's no one way that is quote-unquote the best. Closely related to this is the potential to refuse to support other approaches either requested by the client or used by other colleagues. Keeping in mind the professional values required in this field, it is vital to create access for clients to a range of treatment approaches, as well as support other colleagues who undoubtedly have training in a variety of methods. This type of diversity is both professional and healthy in the field, as it creates that much more potential to reach clients needing services. A final example of a drawback to be mindful of is the issue of self-disclosure in the recovery field. There exists a range of ideas and thoughts regarding sharing information, and this becomes an individual decision for each provider. There's no one right way or one decision. That being said, there are some generally agreed upon guidelines concerning self-disclosure. These guidelines discuss the importance of using factors such as what is in the best interest of the client, the actual clinical need, and cultural considerations when making a decision in this area. In relation to recovery, there are times clinicians may share too much or focus too often on their own recovery experience, which can then have a potentially negative impact on clients. So this is another example where professional values need to be maintained. Related to self-disclosure is a topic that is discussed frequently, recovering versus non-recovering providers. Again, here it is natural to have one's own personal beliefs, but when looking at a way to foster quality and diverse services, it's important to recognize the benefit that each type of provider can offer. Having both types in the field really serves a valuable purpose and allows agencies to offer clients a wide range of providers with diverse experiences and training. When summing up this area of provider considerations, often two key ideas are important to remember. One, the focus on maintaining professional values in the field as well as supporting clients in the ethics of the workplace. And two, the idea that providers work within their scope of practice. This means that each provider offers services and does tasks only within their scope of training. When looking at treatment services, an additional consideration that needs discussion is the recent publication of the DSM-5 in May of 2013. This publication made substantial revisions to substance-related and addictive disorders, and will do a brief review of some of the revisions relevant to the human services field. The first revision is in the area of what addictions are included. In the past, substance use disorders, or what has been commonly referred to as chemical addictions, were the only focus. However, due to many studies indicating that certain behaviors can be addictive in a way that impacts similar areas in the brain and result in similar actions, the category of behavioral or process addictions was added. Gambling is now included in this section, with other process addictions such as internet gambling disorder are included in Section 3, which requests further study. Another revision relates to the criteria used to diagnose substance disorders. This area has been broken down into symptoms that demonstrate impaired control, social impairment, risky use, and pharmacological criteria. With this revision, the symptoms listed are applied to all classifications of substances, with the recognition that some symptoms may be more pervasive in some areas, as well as some symptoms may not apply in a few instances. To view the full diagnostic criteria for substance-related and addictive disorders, please review the summary sheet included in this week's folder. Another substantial revision is the change in diagnostic categories themselves. Prior to the DSM-5, substance use disorders were diagnosed generally under abuse or dependence. You can see more detail for each of that in Chapter 18. With the DSM-5, this has changed to mild substance use disorder, which is 2 or 3 symptoms, moderate substance use disorder, 4 to 5 symptoms, and severe, 6 or more. As you can see, while this is only a brief overview of some of the main revisions related to the DSM-5 substance-related and addictive disorders, the revisions have proven to be substantial for the recovery field. The last additional consideration related to prevention and treatment is a specific type of treatment approach referred to as harm reduction. To finish up our overview of treatment approaches, we're now going to take a look at this approach called harm reduction. In general, this has been one of the more controversial approaches when it first emerged, but has now gone to being regularly implemented in a variety of social areas, not unlike many of the treatment approaches included in the text. For example, when we look at harm reduction, there are many areas in society where a type of harm reduction approach is being used. For example, free bus rides or taxi rides on New Year's Eve can fall under harm reduction. Also, a designated driver program could be considered harm reduction. Why? Because the key focus of harm reduction is to create practical community strategies to reduce the negative consequences related to addiction. In addition to the examples already listed, some practices that have been included under the harm reduction approach are needle exchange programs, reduced use, diversion programs, free HIV testing, and the Good Samaritan overdose law. The idea is to look at ways to reduce harm as opposed to drawing a hard and fast line regarding substance use, which has often marginalized and or stigmatized many seeking recovery who have struggled with ongoing relapse issues. Remember, with harm reduction, abstinence may still be a goal, but the main idea or goal is to meet users quote-unquote where they are at in a non-judgmental manner. Harm reduction does not attempt to force people to make specific or certain changes, but looks for where they do want to or can make a change and seeing those as important and valuable steps. This can often create what we call a quote-unquote window of opportunity regarding recovery, and a way to increase a person's sense of self-esteem and foster a belief that maintaining change or creating more change is possible. It also addresses the conditions of use or associated behaviors that may be harmful in addition to the addiction itself. It is not about quote-unquote permitting or being soft on use, but look at ideas of reducing the transmission of diseases, reducing deaths, and empowering communities. The societal benefits of harm reduction have been studied extensively and include areas such as increases in public health, reducing deaths, and reducing crimes, as well as revitalizing communities. Lastly, in this area, medication-assisted treatment, as outlined in the text, is often viewed as linked to the harm reduction approach, or actually listed as a specific example of harm reduction.